Welcome back to the morning show here on Arise News. We're still joined by consulting cardiologist and co-founder of Nuveen Healthcare, Dr. Monisola Adanijo. Thank you for staying with us. Dr. Adanijo, I wanted to speak to you about Nuveen Healthcare itself. I know that you are the co-founder. It seems to be an amalgamation of your career over the past 20 years. If you could tell us about that journey to found that healthcare centre, and then also go on to talk to us about the 10,000 Hearts Project. I think our viewers would be very interested to hear.
When I was a resident, it's a very interesting story. I was in the A&E, and this couple were at the wedding reception, and the groom, during the cutting of the cake, the groom actually slumped and had a stroke, and they were rushed into the emergency room. The groom was 35 years old. You never knew he was hypertensive, and imagine such a traumatic event on your wedding day. The bride came to the A&E in her wedding gown, crying profusely. You know, her new husband was unconscious, you know, and things like that. When he eventually regained consciousness, he told us that he never knew he was hypertensive. He had never checked his blood pressure. And the first time he was realizing this was when he had a stroke during his wedding reception. Now, this actually touched me, and I just felt, how many people are walking around, you know, they don't know their numbers, they don't know what is going on with them, and the first time they know is when they either have a major life event or unfortunately they die. So we decided to start, you know, this to screen people for risk factors of heart disease, screen people for hypertension, screen people for diabetes, obesity, and things like that. Educate them and make them take decisive steps towards, you know, caring more for their hearts. Now, the 10,000 Hearts Project is basically, you know, about screening for heart disease. So the plan is to screen 10,000 adult Nigerians for heart disease, and not just screen them, educate them, and, you know, start treatment and put them on the path to health, you know, to prevent sudden death and premature mortality from heart disease.
Wow, that's fantastic. When can it be said that a person's BP is high or low? How do you read it? Which of them is more dangerous and can be controlled?
Right. So high blood pressure basically is when your blood pressure rises above acceptable levels. Now, over the years, acceptable levels have changed. You know, in the early 80s, it was 160/100. Later, it became 140/90. But recently, the highest acceptable blood pressure is 130/80. So if your blood pressure is above 130/80, then we need to start looking at how to manage your blood pressure. Okay. And if your blood pressure is less than 90/60, you know, then that is low blood pressure. So blood pressure of 90/60 to 130/80 is actually normal blood pressure. BP is never static, it's actually a range. So it depends on what is going on at that particular time.
Okay, so how do you begin to control, which is riskier, high or low?
Okay.
And then how do you control it?
Okay, so low blood pressure doesn't happen in isolation. So when someone has low blood pressure, it's due to fluid loss. So the person is either bleeding or vomiting or has diarrhea. That's low blood pressure. BP falls below 90/60. So that's usually in a disease condition as is. Now, BP higher than 130/80, the person is walking around, he has no symptoms. So there are two ways to treat blood pressure. You can treat with lifestyle and diet alone, so that's exercise, salt reduction, eating lots of fruits and vegetables, portion control, and things like that. Or you can do a combination of lifestyle and medication. So all the lifestyle features, as well as using medication every day. Now, it's important to note that blood pressure can be treated, as in eradicated. It's managed. So for as long as you're alive, you need to keep up with the lifestyle and keep up with your medication so as to keep your BP under control. Earlier, I said treat to goal. Now, goal of the blood pressure is to be about 130/80. That is the goal of the BP when you're on treatment for blood pressure.
Treat to goal.
Thank you very much. When we talk about healthcare, quality healthcare and access to it, one of the most common barriers is cost. A lot of people are shunned away I don't even mean shunned away by other people, but they may not even seek to approach a healthcare professional, or approach a hospital or a specialist until there's a grave reason to, because of fear of cost, a lack of access. So when we talk about costing, what do you think the best thing forward for people to do is? I'm sure that on the one hand, there is definitely medical insurance and making sure that if you have access to that, you can definitely have access to healthcare. But for people who are unaware or have no idea really how they can access quality medical healthcare, what would you advise them to do?
Okay, so exactly as you said, health insurance is widely available and it's not as expensive as it used to be. Coverage goes for as little as 1,000, 5,000 naira these days. But apart from that, I think the simple things we do, would go a long way. Take, for example, when things get complicated, obviously you tend to pay more for healthcare. It's cheaper and it's easier for you to treat illnesses when they're just starting. So preventive healthcare, going to the hospital whenever there's something small wrong with you. Don't wait until it becomes a huge thing. So checking your blood pressure really is free in many places. In the markets, people go around with blood pressure machines, with weight machines. These are little things you can do. But generally, healthcare, the more complicated your problem is, the more expensive it gets. So it's better for us to treat things early, to go to the hospital earlier so that we don't wait for complications and then we need millions of naira to treat, these issues.
Which group or gender are more prone to heart attack?
Okay, so generally, men are more prone to heart disease. However, more women die from heart disease than breast cancer and cervical cancer. So even though heart disease is commoner in men, it's also extremely common in women and is the leading cause of death of women worldwide, more than breast cancer and cervical cancer.
So what are those two? You didn't know that? Okay, I knew that more men because we stress out a lot. Because there are so many things to stress out too. You agree, right?
No, I mean...
You agree, don't worry. That's just gone. You agree that you don't have any choice but to agree. Anyway,
there's plenty.
So the youth, they're not prone to that. You talked about a young man who just had his wedding and was 30-something, yes, and had a heart attack. Why do they fall in?
Okay, so in the past, we used to say, heart attacks or heart disease was commoner in people in their 50s and in their mid-40s. But these days, because of our lifestyle, we tend to see younger and younger people. I have patients in their 20s who are hypertensive, coming down with hypertension and all these things. And it's basically a lifestyle thing. We're eating out more, we're eating more salt, we're smoking more, we're drinking more, we're under more stress, we're bigger than we used to be, as in obesity and things like that. So we're seeing all these lifestyle illnesses, hypertension, diabetes, high cholesterol, more and more in younger people than before. And then unfortunately, younger people tend to be a bit more carefree and they don't take things seriously like older people do. And that's why when we discover these things, it has gone far. Because by this man that was 35 that had a stroke, obviously he didn't develop hypertension the day before his wedding. He must have been hypertensive at least 5 years before, and he never knew, he never checked before this, catastrophic life event happened. So it's extremely important for young people. Yes, we're young and we're living our lives, but we need to be careful with our lifestyle. Because whatever we do today, we reap the fruits in 5-10 years' time down the line.
It's true.
Exactly.
All right.
Dr. Monisola Adanijo, thank you very much for your time and for this very insightful conversation. We've definitely enjoyed having you indeed.
Yeah, we did.
It's time now for a short break, and when we come back, it will be all about the latest COVID-19 global update. Stay with us.
This isn't the first time we've had to show love to complete strangers. It isn't the first